Hello again. Here I am, Miss Mary, and this is chapter 41 of Fundamentals, Medical Asepsis. So let's rock and roll, okay? All right, so first we'll talk again about standard precautions. They're the guidelines that are used for the delivery of care for everyone, okay? When you think that you're going to be potentially in contact with blood or body fluid, then you're going to use standard, also known as universal, precautions. And what does that mean? Gloves, could be a gown, but it's gloves for sure, right? Depends on using your clinical judgment based on what you think you're going to be coming in contact with. Okay. Um, the way to keep yourself safe is a few things. Number one, you want to make sure that you have your immunizations, right? All your immunizations, your hepatitis B series, your COVID vaccine, your flu shot, all that stuff. And if you're really, really sick, don't come to work. Okay. Hand wash, hand wash, hand wash. The number one way to prevent the transmission of infections is washing your hands, wearing your gloves, wearing your PPE. If you have to cough or sneeze, into your elbow. Okay. And then teaching our clients and their visitors how to, hygiene with regard to respiratory things and always eliminating waste that is potentially a biohazard the right way. Okay. That's really, really important. Um, when you're cleaning up any kind of biohazardous waste, and that's like blood, body fluids, you want to make sure that you're handling them properly. You change a bed. You want to make sure that you're not holding that laundry against your body, right? The dirty linen. You want to bag it in the room, knot it, and get it out. If surface disinfection is needed, so there's been a blood or body fluid spill on a table, on the floor, whatever, the appropriate protocol is a bleach water combination. The ratio is 1 part bleach to 10 parts water. That will kill pretty much anything. Okay. So, what is asepsis? Asepsis is a practice that minimizes or eliminates pathogens. Okay. And there are two types there's medical asepsis and surgical asepsis. Medical asepsis is also called clean technique. And the goal is not to eliminate, but to reduce the number of microorganisms from one person to another, right? Surgical asepsis is sterile technique. The goal there is to destroy all organisms. And you don't use sterile technique all the time, but in some instances you would. And you want to make sure that you're doing it properly. And we're going to talk about that. So, what is an HAI? Healthcare associated infection. Also used to be called a nosocomial infection. It is an infection that someone acquires when they go into a healthcare facility. And we as providers can contribute to these HAIs by not following standard precautions or not wearing the right equipment or not doing a procedure properly. There are lots of things that we can do to, help these patients acquire these infections. And really what we're supposed to be doing is stopping that from happening. So what are the most common healthcare acquired infections? As of 2020, CAUTI, catheter associated urinary tract infections. Somebody who came in, we put an indwelling urinary catheter in them, and they got a UTI. Surgical site infections, self-explanatory. Bloodstream infections. Again, any infection that goes into the bloodstream could be because of an IV. Okay. Pneumonia. Pneumonia is a huge complication for patients that go into the hospital if they're not deep breathing and coughing the way they should postoperatively, and for lots of other reasons. Like I said, back with the PPE not being used correctly, etc. And these kinds of infections can be either endogenous, that means within the body, that microorganisms that already exist inside of us, or exogenous, outside of the body. So when I say endogenous, I mean Staph aureus, Staph epidermis, C. diff. They're different E. coli. They live in our bodies and they're kept in check by other good bacteria, right? There's a balance, but they can get out of control and override the good bacteria and become an infection. And then exogenous infections are infections like salmonella, which you can get from food, and also Clostridium. Fun fact, when you see words that are italicized, those are the names of bacteria. And there are lots and lots and lots of bacteria out there. So Also, infections can occur when somebody's immunocompromised. In other words, their immune system is not up to par as it should be. And why would that happen? Well, trauma and illness can really suppress the immune response. Pre-existing diseases, poor health, you know, age, the very old and the very young, they have kind of weaker immune systems. Medications like long-term use of corticosteroids, prednisone, right? That'll suppress your bone marrow, suppress the production of white blood cells, make you immunocompromised. Inactivity. Harvard Medical School says that sitting is the new smoking. Inactivity is not good for your health. Poor nutrition, inadequate hydration, and stress. Yes, you heard me. Stress. If you're stressed out, your immune response will be suppressed. Other factors, fatigue, not getting enough sleep, invasive types of therapies where, we're going into the body. We're always opening you up to risk of infection. Frequent or inappropriate use of antibiotics. So, in other words, you get an antibiotic for a bacterial infection, it's prescribed for 7 days. You feel better by the fourth day and you go, I'm not going to finish taking them. Not good. What that does is that gives the bacteria a little taste of that antibiotic and allows it to become what we call an MDRO, a multi-drug resistant organism. Okay. And when you think of multi-drug resistant organisms, think of things like MRSA, methicillin resistant Staph aureus, or VRE, vancomycin resistant enterococcus. Okay. Also, inadequate primary defenses. Your skin is a primary non-specific immune defense that you have. If it's compromised, if there are open areas, that's risk to let bacteria, viruses in. And then certain situations can cause you to be immunosuppressive. For example, if you have HIV or AIDS, or if you're receiving treatment for cancer, such as chemo or radiation, because both of those suppress the immune response. Okay. And I'll look at that misspelling, radiation. Okay. You want to break the chain of infection. I'm sorry. Right. Yeah. You want to break the chain of infection. I'd rather use the picture. So this is a representation of what the chain of infection looks like. So how does it start? Well, there's got to be a pathogen, a bacteria, a virus, a fungus, something that has the potential to make you sick. And then the pathogen has to have some place to live. That's the reservoir. Okay. And the reservoir can be a person, can be an animal, it can be soil, it can be food, it can be water. There are so many different places where, pathogens can live and thrive. Well, then the pathogen has to get out of its reservoir. So that's the portal of exit. Okay. And then once it gets out of its reservoir, there has to be a way for it to transmit to another person. And modes of transmission would be contact, vectors, vehicles, and we'll talk about all of that, right? And then it's got to get into another person. What's the portal of entry? The mouth, the eyes, the nose, the ears, right? Cuts in your skin. And then the person that has that portal of entry needs to be a susceptible host. So, in other words, the very old, the very young, people who are immunocompromised, but also anyone has the potential to be a susceptible host. Okay. So let's backpedal and look at this again. Let's say that I have the flu. So the pathogen is the flu virus, and the reservoir, it's living in my respiratory tract. And the portal of exit is me going and coughing. And droplets are spewing. Mode of transmission, droplet. Portal of entry, if I'm and you're less than 3 feet away from me, you don't see them, but those little droplets are going into your respiratory tract, and then they're going to make you sick. And now you have the flu. Easy peasy, lemon squeezy. Okay. So, what are the risks for nurses? You make sure you get your immunizations, right? Take preventative measures. Hepatitis B, MMR, polio, tetanus, diphtheria, the flu, pneumococcal, meningococcal, the shingles, COVID-19, your PPD testing. And wash your hands, 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 wash your hands. Okay. Most facilities will have an infection control committee or an infection control team, or at least an infection control nurse. And what they're doing is they're watching for any healthcare associated infections. They're going to investigate them. They're going to come up with statistics about how many there were and when they happened. They're going to teach the clients, the staff, families, and they kind of act as a liaison between the facility and the community, right? They kind of, you know, help to teach everybody and bring everybody together so that we can decrease the number of infections. They also monitor the community and the world. Think about when COVID hit, right? We really didn't know initially what it was. So we were relying on information from like the World Health Organization, so to try to plan ahead, to try to prevent people from getting it. Is the following statement true or false? It's necessary for a healthcare worker to take precautions to prevent breakage of the skin or compromised skin integrity. If you said true, you'd be right. Skin integrity, that's our first line of defense. It is the best barrier that we have. Okay. And then back to hand washing. I can't say this enough. The single most effective way to reduce the transmission of disease is washing your hands. You have to wash your hands thoroughly with soap and water, and it doesn't even have to be antimicrobial. It could be any soap and water. There's got to be friction, right? You have to make sure that you're getting between your fingers, under your nails. Rinse your hands. You should wash your hands for a minimum of 15 to 20 seconds, which is 1 to 2 renditions of row, row, row your boat gently down the stream. When you're done washing them, you let the water run, get paper towels, dry them off, get a new paper towel, turn the water off. Okay. You have to do hand sanitizing before and after client contact, before you put gloves on, and after you take gloves off. And to choose whether it's hand washing or hand sanitizer, are your hands visibly soiled? Or were you in contact with someone who has C. diff? Wash your hands. If not, then you can definitely use a hand sanitizer. Same rules apply for the hand sanitizer. Put some in one rub your hands together, under your nails, everywhere, until your hands are dry. Okay? Um, and that's what I already said, right? Okay. And there's hand sanitizer usually everywhere, like everywhere, everywhere. And here are the instructions for hand sanitizer, but I beat the PowerPoint to the punch, right? About 20 seconds. Okay. Is the following statement true or false? It's adequate for the nurse to use hand sanitizer if the nurse was in contact with client's body fluids. If you said false, you would have been correct. If you have been in contact with body fluids, wash your hands. Wash your hands. Okay. Gloves, most commonly used personal protective equipment, but a lot of gloves are made of latex. Okay. And latex allergies are a problem. Okay. Um, they have to be discarded appropriately. So I'm going to show you how to take off your gloves, how to put them on and how to take them off. Okay. That's really important. Okay. So gloves. This is a pair of nitrile gloves. These are non-latex. I don't have a latex allergy, but it's what I had in the house. So when you put your gloves on, and this is not sterile technique, this is just clean. Put your gloves on, and now you've already washed your hands. Okay. Gloves are on. I'm going to do whatever it is I'm going to do. When it's time to remove the gloves, okay, what you do is you grasp the edge here, pull this glove off, put it in your hand, and then get underneath the cuff and pull the glove off. So you've got a nice, neat little package here. Nice, neat little package here. Okay. And so the dirtiness is inside the gloves, and then you dispose of them. Okay. You must know that if the patient is allergic to latex or anybody's allergic to latex, they are also allergic to bananas, avocados, and kiwi fruit. So make sure you know that. Remember that. Okay. Um, and what kind of reactions can somebody get when they're allergic to latex? Contact dermatitis, which is a rash, hives, urticaria, pruritus. Oh, there's another spelling mistake. Okay. And all of these different things. Just know the common reactions if you have a latex allergy. And people that are at risk for latex allergies, if you have a history of asthma, spina bifida, certain neural tube or genitourinary birth defects, if you get catheterized frequently, they can put you at risk for developing or having an allergy to latex. Okay. And think about latex. Latex is in a lot. It's in catheters, it's in binders, it's in elastic waistbands, condoms, balloons, right? So there's a lot of latex all over the place. If a patient comes into a facility and they're allergic to latex, that's got to be documented, and they're going to only be able to use non-latex catheters, IVs, all those things, which the hospitals facilities have. And the client should wear an allergy ID band, and then there should always be either Benadryl or an EpiPen or something available in the event that they do come in contact with it and have a reaction. Masks, different kinds of masks. So there's a fitted particulate respirator, an N95. That is the mask that's not one size fits all. It's extra small, small, medium, large, extra large. They fit it to you by putting it on, and they do this little poof next to your face of saccharin. You shouldn't be able to smell anything. Saccharin smells super sweet. So if you don't smell it, the mask fits you properly. So that is for airborne precautions, which we talk about in chapter 42. Surgical masks are the ones in the boxes, one size fits all, right? Um, you should always put your mask on before you put your gloves on, and don't touch your mask with your gloved hands, right? When you're removing PPE, the dirtiest thing comes off first. So gloves first, then you can take off your mask. Okay. You never want to touch dirty gloved hands to your face, right? Okay. And here's pictures. So that is an N95. And that's just a handy dandy garden variety, one size fits all surgical mask. Okay. I mean, they serve a purpose. These are really efficient at preventing, certain things like tuberculosis, measles, varicella, getting through the airborne diseases. Okay. There are also goggles, there are face shields, all types of different kinds of eye and face protection. And then there are gowns that we can wear also. So depending on what your task is, that will dictate whatever PPE or personal protective equipment you would use. Okay. All right. And then, so make sure that you're working in a clean environment. Make sure that you're taking care to clean your area. And remember, like I said, a bleach solution, 1 to 10, will kill HIV. It'll kill anything, right? That's all I want you to know. Make sure you understand sharps containers. They're puncture proof, usually red containers. Anything sharp, hence the name, goes in them. Seal and dispose of them when they are 3/4 full. Okay. Do not wait for them to be overflowing. That's a no-no. Okay. And biohazard bags are usually red. If you have a patient that's got an infection and it's in a wound and the wound is draining copious amounts of drainage, you want to put that in a red biohazard bag, not just in the regular trash. Okay. Okay. When you are leaving the room of an infected client, you take your PP off in the room. Wash your hands. Okay. Before you leave the room. Don't leave an infected client's room with any of your personal protective equipment on, because what you're doing is you're bringing whatever infection they have out into the hallway. And you don't want to do that. And I've given the instructions for how to wash your hands. Okay. Don't worry about terminal disinfection because you're not working in SPD. Um, you need to teach families and clients, visitors about hand washing and, the way to handle food. There are many diseases that are transmitted through food. Hepatitis A, oral fecal. Someone makes a sandwich after they just went to the bathroom but didn't wash their hands. They have Hep A, so do you. So that's a problem. Okay. And make sure you're getting rid of contaminated material appropriately. Um, any prolonged exposure to microorganisms that are in the air can make anything sterile unsterile. So when you are getting a sterile field today, what you want to do is the field should be the height of your waist, no higher, no lower. You shouldn't cough or sneeze or talk directly over a sterile field. You shouldn't lean over a sterile field. And we're going to go over this in more detail live and in person. If you're working with a client and you have a sterile field, advise them to kind of stay put, not make any sudden movements, don't touch anything. Don't turn your back on your sterile field, and hold items that you want to add at a minimum of 6 inches above the sterile field. Like if you opened up a package, you would drop the items there. Okay. That's very important. When you open up sterile packages, like this is just a package of sterile gloves, you inspect the package to make sure it's intact. Okay. And then you're going to open it away from you, place it down on a clean surface, right? So that these are sterile gloves. You're always going to start with your dominant hand. I'm right-handed, so that's my dominant hand. Okay. So I open the package. I use my dominant hand. I'm sorry, I use my non-dominant hand to pick up the dominant hand glove, put my hand in it. Okay. And then I can, because now my hand with the glove on it is sterile. So I use my dominant hand to pick up the non-dominant glove, but I have to grasp it inside the cuff because that's the sterile part. Okay. So when I'm picking it up, I'm grasping it. See that picture? Inside the cuff. Then I'm going to slide it on my other hand. Then I can make adjustments because now both of my hands have sterile gloves. So they're both sterile. They can touch each other at this point. So if it's not on right, I can fix it. Okay. And then sterile field. Always remember that 1 inch around the edge of your sterile field is considered contaminated. Don't forget it, okay? And only touch sterile things with sterile gloves. Anything that's held up high or down low, contaminated, all right? And again, when you're setting up that sterile field, remember everything gets opened away from you, okay? Away from you. And we'll go over this live and in person. There's a picture of someone opening up a sterile kit. And this is a picture of an indwelling urinary catheter kit. You've got your drainage bag with its tubing. You've got a sterile cup in case you need to get a urine specimen. This is old school. It's got tweezers and cotton balls. You put some povidone iodine, betadine on the cotton balls to wipe the urinary meatus before you placed the cath. You've got this is lubricant that you would lube the lower portion of the cath before you would try to insert it. And then this is sterile water and a syringe that you use to blow up the balloon that keeps the catheter in the bladder. But again, we'll go over this in more detail. Okay. And then there's also some instructions on how to open sterile packages and how to pour sterile solutions. Here's something you must know. Whenever you open a bottle of a solution, normal saline, sterile water, right? Bottle, they're good for 24 hours. Okay. That's it. 24 hours because facilities are filled with pathogens. So you will always put your initials, the date and the time on the label to make sure that you know that 24 hours after that, you got to dispose of it, even if it's still mostly full. It's become contaminated after 24 hours. Most facilities adhere to that. That's a CDC guideline. And that's it for asepsis. So until next time, I am Miss Mary and I am out of here. Okay. Bye.